I'm Nima Rajan, and this is Forum Daily Week in Review. Erin O'Toole has been ousted as federal Conservative Party leader by a vote of 73 to 45. Caucus members cast secret ballots this morning. This was after about one-third of them signed a notice that triggered a leadership review. They are now expected to choose an interim leader. Erin O'Toole was elected Tory leader in 2020 after running as a true blue candidate. But he came under fire from grassroots party members for flip-flopping on several issues and trying to steer the Conservatives in a more moderate direction. Well, with us to unpack this situation and what it means for the party is Mr. Yanni Makris. He is a political consultant with the Daisy Consulting Group. Mr. Makris, welcome to Forum Daily.
Thank you, Nima. Thank you for having me.
So take us back to what led to this vote to remove Erin O'Toole in the first place.
Well, first and foremost, I think there were a multitude of different factors that resulted in the removal of Mr. O'Toole. Whether it was flip-flopping on issues like you had said, or the inability to take a specific side with respect to COVID-19 measures, or even his desire to move the party in a more progressive or moderate direction, I don't really think it's accurate to conclude that there is one specific issue that resulted in the removal of Mr. O'Toole.
So was the result of this secret ballot vote expected for you?
I mean, personally, I didn't expect it. I mean, politics is full of surprises. I mean, the final vote was 73 to 45, and I think that says a lot, especially when only 35 MPs signed a letter to caucus looking for his removal. And I think that what was most surprising was that 73 actually voted to remove him.
All right. Well, we mentioned Mr. O'Toole was aiming to move the party in a more moderate direction, which some MPs disagreed with. So what are these main divisions within the Conservative Party currently?
Of course. I mean, there's always been tension within the Conservative Party since the departure from Stephen Harper and arguably since the formation of the party in 2003. The divisions between the social conservative wing and the more progressive red Tory wing have been amplified in the media, especially in recent times. And that's obviously no secret. But I mean, look, this is what happens when you have a Big Tent party, especially one that focuses on grassroots and enables party members to have a say in the direction of their party. But I mean, at the end of the day, not everybody's going to agree, and that's just politics.
And Mr. O'Toole isn't the first Conservative Party leader to have left this post. We know in December 2019, Andrew Scheer resigned, and now O'Toole has been ousted in 18 months. So what does this say about the current state of the Conservative Party?
Well, I mean, I think the consensus right now among the general public is probably that the party is in crisis. I certainly don't think that's the case. Rather, I think it's an opportunity for the party to come together with diverse ideas. But again, the perception of disorganization and internal disagreement is certainly discouraging for people outside of the political bubble. And I think that's what politicians and staffers tend to forget is that how's the general public going to perceive, infighting within the Conservative Party?
All right, Mr. Makris, just about 2 minutes left here, but are there any immediate impacts to be had from Erin O'Toole being voted out as leader?
Oh, for sure. Like I said, right now the party looks fragmented. What we're going to see now is kind of a scramble to find an interim leader, which will happen tonight at 7 p.m. And that'll be selected by caucus with an eventual leadership contest. And that leader is going to have to resell the Conservative brand, that it's united, and that and ultimately lead the party to the next leadership election.
All right, Mr. Makris. Well, walk us through the process to select a new official leader of the Conservative Party and how it will likely pan out.
So, I mean, first things first, caucus has to elect a new interim leader who, according to the party's constitution, cannot be nor become a candidate in the leadership selection process. Afterwards, the leadership election organizing committee will begin planning a leadership election, giving an election date and a campaign period. But I mean, it's too early to say when this will happen, as it does take a lot of planning to be able to facilitate a leadership race.
Okay, well, just a minute left here, but MPs, as you mentioned, will now need to choose this party's interim leader. Who are some likely options right now?
Look, obviously, the first person that comes to mind is Pierre Poilievre. It's no secret. I mean, he's been the most popular Conservative politician for quite some time now. Few other possible contenders are Leslyn Lewis, who have always had the support of the social conservative wing of the party. But, Nima, I also think that there will be calls from former Premier of Saskatchewan, Brad Wall, former interim leader Rona Ambrose, and former PC leader Peter MacKay, who in fact was a 2020 leadership contender, to put their names forward. But either way, I think that we'll be seeing some familiar names and faces in the next Conservative leadership race.
Minister Yanni Makris, a lot to keep our eyes out for as this situation develops, but thank you so much for joining us today on Forum Daily.
Thank you for having me.
We spoke with Senator Rosemary Moody about the beginning of Black History Month in Canada. Stay with us. Today marks the start of Black History Month, where Canadians remember and pay tribute to the many Black Canadians who made a difference in the country and around the world. This year's theme is called February and Forever, celebrating Black history today and every day. But as we enter our third year of the pandemic, we have learned more about the societal gaps that Black Canadians continue to face, from unemployment rates that are high to even higher COVID infection rates. Data from the Institute for Clinical Evaluative Sciences looked at the first 3 months of the pandemic in Ontario, and it indicates that people living in communities with the highest number of visible minorities or immigrants were 3 times more likely to test positive for COVID-19. Well, joining us now to give us her perspective on these disparities is Senator Rosemary Moody, chair of the African Canadian Senators Group and co-chair of the Parliamentary Black Caucus. Ma'am, welcome to Forum Daily.
Hello, and thank you very much for having me, Mina.
Thanks for joining us, ma'am. Now, looking at this research, it indicates that people of color in North America are more likely to be infected by COVID-19 because they're more exposed and less protected, and at the same time, more likely to die from COVID because of poor living conditions and poor food options. So how can we as a society tackle all of this?
So you're right. It's a really important question that you're raising here, and an issue. We know that many of the communities that you describe are those essential workers. They're the frontline workers. They're the grocery store workers, the service industry, the maintenance service industry. And so these folks are out there and they have to be out there because they need the money, they need the work. And so they are in precarious jobs and sometimes paid less, and their lifestyles force them to have to turn up to work. Some of the interventions and the policy interventions that have happened recently will, I think, play an important part in helping solve the problem. One of them is paid sick leave, which I think is going to allow, if we can expand beyond the federal service, which the recent legislation restricted it to. It will help if it can spread at the provincial level and more broadly. I think also another big issue that we need to pay attention to is good housing, because right now crowded conditions are one of the biggest issues for families that are really unable to isolate as they possibly could, separate themselves off if one member of the family is ill. And so people are finding themselves often part of an outbreak in a home or in communities spreading really quite unrestricted. I think too that we need to look at more robust income support. If we can look at raising the minimum wage, making sure that the tax structure is more progressive and assists low-income Canadians. Those are the sorts of things, a living wage, are things that are important considerations for us moving forward. We need to be thinking about these things. And post-COVID, we really need to focus on our communities around education, encouraging them to take the vaccine, because frankly, there continues to be a large number of myths and misinformation that's circulating amongst our communities, and really standing as barriers for people getting immunized against COVID. So these are some of the important things. When I visited Taibu Community Health Center, there's some fantastic work being done by members of our community. I saw firsthand the incredible work that they were doing to increase vaccination rates in their community. We need more of that.
It's good that progress was made, ma'am. Now, just a minute left here. So let's end with what would you want this year to mean in terms of equality for all Black Canadians for the 2022 year?
What I'd like to see for Black people in Canada today is that we address the systemic disparities and the biases that affect and limit their ability to progress economically and to progress from a position of political power decision making. It is my hope that we will shift our political culture towards the consideration of Black Canadians as we move forward, and that we're able to see a more diverse society that works hard in an ongoing and quite deliberate way to ensure that there's diversity and inclusion in all aspects of our lives.
All right, Senator Moody, thank you again for joining us today for this Black History Month special. Up next, an interview with Dr. Abhishek Raut on the effects of easing COVID-19 restrictions on our healthcare system. The World Health Organization chief says 90 million cases of coronavirus have been reported in the world. This since the Omicron variant was first identified 10 weeks ago, which amounts to more than in all of 2020, the first year of the COVID-19 pandemic. With many countries easing restrictive measures, WHO Director General Tedros Adhanom Ghebreyesus cautioned that Omicron should not be underestimated, even though it has shown to bring less severe illness than earlier variants. He cited a very worrying increase in deaths in most regions of the world. This comes as COVID-19 health restrictions begin to ease across Canada, and some provincial leaders begin to think about potentially living with the infectious Omicron variant and any others that may pop up. But how do we go about that without overwhelming our health system again? Well, joining us now for our weekly medical segment is Dr. Abhishek Raut, Medical Director at Apple Tree Medical Group. Dr. Raut, welcome back to Forum Daily.
Pleasure to join you.
So what is the current state of Canada's healthcare system following the emergence of the Omicron variant just 10 weeks ago?
Well, what we're seeing is a health system that is strained by a pandemic wave that's hit at the worst possible time. It's caused significant illness in our own healthcare workers, which means less staff in hospitals, and clinics are filling up with COVID-19 patients more than ever, and they need hospitalization and care. To keep up, the hospitals have asked staff to forego holidays or take overtime shifts, which of course means asking healthcare workers already exhausted by 2 unrelenting years to take on more work. The problem is global, however. A report from the International Council of Nurses this week said that sickness, burnout, and staff departures are taking a toll on the world's nursing workforce, which has been unseen so far in the pandemic.
And how does all of this compare to the beginning of the pandemic when it first emerged in 2020?
At the beginning, we saw our healthcare workers energized, ready to take on the challenges of this new disease. Initially, there was very little we knew about COVID-19, but over time, we've learned about its virulence, effective sanitation methods, vaccinations, and we were quite successful in deploying those vaccines to help battle the infection. But during that time, our healthcare workers were strong and resilient. But even this incredible resilience may be fading for many. And I think there's only so much we can ask our frontline workers to do.
Indeed. And on that note, we've seen a surge in 2020 on the onset of the pandemic. The Delta variant caused a surge, and now we're seeing surges in Omicron. How have these multiple surges in cases affected the morale and mental health of health workers from your personal experience, Dr. Raut?
It's a good question. I think the COVID-19 science table, which is the advisory table for Ontario, sums it up quite well. In the spring of 2020, the prevalence of severe burnout was about 30%. Not a great number, but there we are. But what we know now is the prevalence of severe burnout is greater than 60% in Canadian physicians, nurses, and other healthcare professionals. The ones that are at particular risk are intensive care setting workers, COVID-19 units in hospital, emergency departments, as well as nurses and younger healthcare professionals or trainees have been at a much, much greater risk of burnout.
Some very concerning numbers there, Dr. Raut. So what needs to be done to ensure our healthcare workers are not further overburdened as more restrictions ease across the country?
So as Canadians, we do take pride in our public healthcare system, but by failing to really adequately invest in it, governments can leave that vulnerable, especially to the ravages of a 2-year-long public health emergency. If healthcare workers leave and are not replaced, thanks to training or certification backlogs, cap wages, or even the perception of a punishing profession, that all hurts health system capacity.
All right, Dr. Rao, just about a minute and a half left here, but switching gears, last week we really talked a lot about this new BA2 Omicron descendant. It was relatively new last week, but what are the most latest developments around this BA2 Omicron descendant?
That's right. So what we know now is BA2 is likely much more transmissible than the common BA1 or the original Omicron, and it's been able to infect vaccinated people, according to a very recent Danish study. The study looked at coronavirus infections in more than about 8,000 Danish households between December and January, and they found that the people infected with BA2 were roughly 33% more likely to infect others compared to BA1. So we expect these results are relevant to us as well. But the good news is preliminary analysis shows hospitalization risks are the same between BA2 and BA1.
All right, Dr. Rao, just about 30 seconds left here, but what does normalcy look like for you as we try to potentially live with COVID-19?
I think once we go past the Omicron peak, we're going to see COVID-19 more as an endemic disease here. At that point, I expect there will still be some need for masks and, of course, hand washing. But it's going to look like the flu, where we get an annual vaccine booster to keep our immune system strong against COVID-19.
All right, Dr. Rao, always great having you on Forum Daily. Thank you again.
Thanks so much.
Next, we discuss Raising the Roof's toque campaign. Raising the Roof has been providing long-term solutions to homelessness in Canada for 25 years. So far, they have raised over $8 million for homelessness prevention programs across Canada. Their annual toque campaign sees hundreds of volunteers and supporters selling toques across the country, with proceeds benefiting community agencies that work directly with those experiencing homelessness. Well, joining us now to discuss how Raising the Roof is addressing homelessness, as well as the challenges to improving the situation in Canada, is Mr. Mark Sovrano, Raising the Roof's Executive Director. Sir, welcome to Forum Daily.
Thank you so much for having me.
So can you give our viewers an idea of the current homelessness situation in Canada?
It's not great. There are 235,000 individuals that experience homelessness, as you mentioned, and housing prices are getting more and more expensive. Out of the G7 countries, there is no other one where the population growth and the amount of housing are as wide apart as they are in Canada. And there's really a lot of work to be done to both create more affordable housing for people to live in and also to prevent people from becoming homeless in the first place.
A lot of work to be done indeed, sir. Now, considering today we're marking Black History Month as well, what do we know so far about the proportion of minorities and Black Canadians that currently face homelessness?
You know, unfortunately, there's not a lot of data in general about the individuals that are experiencing homelessness in Canada. Definitely people from marginalized communities are experiencing it at a far more significant rate. As we're building housing, we're training and employing people experiencing homelessness. And about 90% of the people we're working with from the training end are Black Canadians. So if that's a representation of the overall kind of population, it's not a great start.
Indeed. And now there are a lot of misconceptions around those who fall into homelessness as well. So can you share with our viewers some of the key causes of homelessness in Canada, especially during this pandemic?
Yeah, there are really a lot of misconceptions, and more so than anything on Toque Tuesday, we're trying to bring awareness to the fact that this can happen to anyone. The response to COVID in Canada has been quick. And I think it's because we could all see ourselves as someone who might get COVID. And I wish that our approach to homelessness kind of had that same sort of tone. And I think connecting people more to the individuals experiencing this is really important. In general, 80% of individuals that are experiencing homelessness in Canada have seen some form of a family breakdown. So really, if we're thinking about prevention, one thing we have to do is keep families together, and creating affordable housing for families to do that. Keeping kids out of foster care is a huge way to work towards that.
All right, sir, just a minute and a half left here, but let's talk about Raising the Roof's initiative. So we talked about the TOOP campaign launching today. Tell us about it and some other initiatives by Raising the Roof to improve this situation.
Yeah, so the TOOP campaign's been going on for 25 years. We have 20 partner agencies across Canada, and when every toque is sold, it's for $15. Half the money goes to the local agency in that city, and half the money goes to Raising the Roof. And what we do with the money at Raising the Roof is we run a program called the Reside program, where we're turning vacant properties across Canada into affordable housing and using the renovations as a way to train and employ people into construction jobs that are experiencing homelessness.
And what would you say are some of the biggest challenges that Raising the Roof is facing in its efforts to provide long-term solutions for homelessness?
Really, it's the funding available to build affordable housing. The government's doing a great job at finding more, but we're just getting started. The land is expensive, contracting is expensive, and it's just an expensive problem to solve. But the cost of supporting individuals that are experiencing homelessness is equally large. And I think there's a real business case to be made to invest in solutions rather than to be paying for the cost of the problem itself.
All right, Mr. Sovrano, quick 30 seconds left here, but how can our Canadian viewers participate in these initiatives?
I mean, the TOOP campaign is all about creating an easy way for Canadians to get involved. I would love for Canadians to purchase their Raising the Roof toque. You'd look great, I promise you. You can get them at raisingtheroof.org, and they're also available at every Home Depot across Canada. In partnership with the Home Depot Foundation. So you can get them at Home Depot, you can get them online. It's a small way to contribute and to start the conversation.
All right, I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. For more news and programming, you can always visit our website, thenewsforum.ca, and make sure to follow us on social media for updates. You can also watch our news and commentary programming on the News Forum YouTube channel. All right, thanks for joining us on the Forum Daily Week in Review.